What if simply changing a few items in your meals could significantly lower your risk of heart attack and stroke without relying entirely on medication? If you're over 50, is your heart and brain already paying the price for what seem like harmless choices in your daily diet? And are there specific foods that can actually protect your blood vessels, reduce inflammation, stabilize blood pressure, and keep blood flowing freely to your brain? In this video, you'll discover a nutrition plan built around 9 simple, easy-to-find foods that have been clinically shown to help prevent life-threatening cardiovascular events. This isn't just a food list, it's a survival strategy for anyone who wants to take control of their heart health in a proactive, evidence-based way. 1. Fatty fish. Fatty fish like salmon, mackerel, sardines, and herring are among the most powerful sources of omega-3 fatty acids. Omega-3s play a critical role in reducing vascular inflammation, stabilizing heart rhythms, and improving the flexibility of your blood vessels. For people over 50, this becomes especially important to prevent sudden vessel constriction, lower the risk of blood clots, and improve circulation to both the heart and the brain. Clinical studies have consistently shown that people who eat fatty fish regularly have a significantly lower risk of heart attack and stroke compared to those who don't. Fish is also rich in high-quality protein and vitamin D, both of which support immune function and help regulate blood pressure. What's particularly important is that omega-3s don't raise LDL cholesterol. In fact, they help lower triglycerides, a type of blood fat directly linked to atherosclerosis. Adding fatty fish to your meals 2 to 3 times a week is a simple but highly effective strategy for preventing cardiovascular events. If you don't eat fish, consider purified fish oil or plant-based omega-3 sources like flax seeds or chia seeds, though plant-based options are not as bioavailable as those from fish. Think of fish not just as food, but as a key part of a long-term vascular protection plan, especially once you've entered middle age. 2. Dark chocolate. Dark chocolate with a cocoa content of 70% or higher is more than just a satisfying treat. It's one of the few foods with proven bioactive compounds that support heart and brain circulation. Cocoa is rich in flavonoids, a group of antioxidants that help relax blood vessels, improve circulation, and reduce inflammation at the cellular level. These compounds also help prevent the oxidation of LDL cholesterol, a key factor in the development of arterial plaque. When blood vessels are more open and flexible, the risks of high blood pressure, poor circulation, and clot formation drop significantly. Long-term studies have shown that people who regularly consume small amounts of dark chocolate tend to have more stable blood pressure, lower arterial stiffness, and a reduced risk of stroke. However, the key is choosing chocolate with a high cocoa content and no added sugar or dairy. Not all chocolate is heart healthy. Only pure dark chocolate contains enough flavonoids at biologically active levels. For adults over 50, enjoying 1 to 2 small squares of dark chocolate per day as part of a balanced diet can offer noticeable benefits to both heart function and cognitive health. This isn't an excuse to indulge in sweets, but a strategic way to use food as a tool to naturally strengthen and protect your blood vessels over time. 3. Tomatoes. Tomatoes are a rich source of lycopene, a powerful antioxidant proven to reduce oxidative stress and inflammation in the blood vessel lining. This helps slow down the development of arterial plaque. Lycopene acts like a biological shield, protecting vessel walls from damage caused by free radicals. It's especially beneficial for people with high levels of LDL cholesterol or unstable blood pressure. In addition to lycopene, tomatoes also provide vitamin C, vitamin E, potassium, and fiber, all of which play a role in regulating blood pressure, improving vascular elasticity, and supporting blood flow to the brain. For adults over 50, these nutrients become even more essential as endothelial function declines and the risk of heart attack and stroke increases. A large European study found that people with the highest blood levels of lycopene had up to a 50% lower risk of stroke compared to those with the lowest levels. Tomatoes can be easily added to your diet through salads, sauces, or cooked dishes. Cooking actually increases lycopene absorption, so using tomatoes in stews or roasting them can be even more beneficial. Choose ripe, fresh tomatoes over processed tomato products that are high in sodium or added sugars. Adding tomatoes to your daily meals is a simple but effective way to support healthy blood vessels and reduce cardiovascular risk, especially as you enter midlife and beyond. 4. Olive oil. Extra virgin olive oil is a cornerstone of the Mediterranean diet, widely regarded as one of the most effective eating patterns for preventing heart disease and stroke, especially in adults over 50. Olive oil is rich in monounsaturated fats, particularly oleic acid, which helps lower harmful LDL cholesterol and raise protective HDL cholesterol. This balance supports healthier arteries by limiting the buildup of plaque inside the blood vessels. Olive oil also contains phenolic compounds with strong anti-inflammatory and antioxidant properties. These compounds help protect the endothelial lining of your arteries and enhance the vessel's natural ability to relax and expand. A large-scale study in Spain found that people who consumed extra virgin olive oil daily had significantly lower rates of cardiovascular death compared to those who used it less frequently. In addition to supporting cholesterol balance, olive oil can help regulate blood pressure and improve insulin sensitivity, factors closely linked to stroke risk, particularly in those with type 2 diabetes. For older adults, replacing butter, industrial seed oils, or trans fats with olive oil is a simple yet powerful change that can greatly benefit heart and brain health. Olive oil can be used in moderate heat cooking, added to salads, or drizzled over steamed vegetables to retain its protective compounds. For maximum health benefits, choose high-quality extra virgin olive oil that is cold-pressed, stored in dark bottles, and sourced from reputable producers. This small dietary shift can play a major role in supporting cardiovascular health as you age. 5. Avocados. Avocados are one of the best natural sources of heart-healthy monounsaturated fats. This type of fat has been shown to lower harmful LDL cholesterol while raising beneficial HDL cholesterol, improving overall lipid profiles in a way that helps prevent atherosclerosis. Avocados are also exceptionally high in potassium, even more than bananas. Potassium is an essential electrolyte that helps regulate blood pressure and ease strain on the blood vessel walls. When blood pressure is kept in check, the risk of endothelial damage and clot formation in the arteries that supply the heart and brain drops significantly. In addition, avocados provide soluble fiber, which helps stabilize blood sugar levels and reduce systemic inflammation. Both of these factors are directly linked to a higher risk of acute cardiovascular events and stroke in older adults. A study published in the Journal of the American Heart Association found that women over 50 who ate avocados 2 to 3 times per week had a significantly lower risk of ischemic heart disease. Importantly, avocados do not raise blood sugar, contain no cholesterol, and serve as an excellent replacement for saturated fats from animal products. You can add them to salads, spread them on whole grain toast, or blend them with vegetables for a heart-healthy smoothie. Think of avocados not just as a tasty food, but as an essential part of your strategy to protect your cardiovascular system, especially as your body becomes more vulnerable with age. 6. Legumes. Lentils, black beans, mung beans, white beans, and chickpeas are rich in plant-based protein, soluble fiber, potassium, magnesium, and a variety of micronutrients that support heart and vascular health. The fiber in legumes plays a key role in slowing the absorption of sugar and cholesterol from the digestive tract into the bloodstream. This helps reduce post-meal blood glucose levels and lowers total and LDL cholesterol, which are major contributors to plaque buildup in artery walls. Legumes are also high in folate and naturally occurring polyphenols that help reduce inflammation and protect the endothelium, the inner lining of blood vessels, from damage caused by oxidative stress. This becomes especially important after age 50, when the body's ability to regulate blood sugar, blood pressure, and systemic inflammation begins to decline. A large-scale epidemiological study lasting over a decade found that individuals who consumed legumes at least 4 times a week had significantly lower risks of ischemic heart disease and stroke compared to those who ate them less than once a week. Unlike red meat, legumes contain no saturated fat and do not trigger systemic inflammation. In fact, the plant-based protein in legumes helps maintain lean muscle mass without increasing the risk of lipid metabolism disorders, a crucial benefit for older adults at risk of muscle loss and physical decline. You can enjoy legumes in soups, salads, stews, or even substitute mashed legumes for white rice to lower the glycemic impact of your meals. Regularly incorporating legumes into your diet is more than a healthy habit, it's a proven strategy for long-term prevention of cardiovascular disease and stroke. 7. Nuts. Almonds, walnuts, cashews, pistachios, and hazelnuts are rich in unsaturated fats, fiber, magnesium, vitamin E, and powerful antioxidants. These nutrients help regulate blood lipids by lowering LDL cholesterol, raising HDL cholesterol, and reducing triglyceride levels, a key risk factor linked to stroke and coronary artery disease. The antioxidants found in nuts also help prevent LDL oxidation, reduce inflammation in the endothelium, and strengthen blood vessel walls, which is especially important for countering the silent damage caused by diets high in sugar, salt, or trans fats. Nuts are also a natural source of arginine, an amino acid that supports the production of nitric oxide in the body. Nitric oxide promotes natural vasodilation, lowers blood pressure, and improves circulation to vital organs such as the heart and brain. A long-term study involving over 20,000 adults found that those who ate a handful of nuts daily had up to a 20% lower risk of heart attack and stroke compared to those who rarely consumed nuts. It's important to choose raw or dry roasted nuts without added salt, oils, or sugar, as those additives can undermine cardiovascular benefits by increasing blood pressure or blood sugar levels. Nuts make a convenient and nutrient-dense snack between meals, can be sprinkled on salads, or blended into oatmeal for a heart-healthy breakfast. For adults over 50, incorporating nuts into the diet 3 to 5 times a week can provide concentrated nutrition to support heart function, maintain energy, and help prevent major cardiovascular events, without contributing to weight gain when consumed in appropriate portions. 8. Leafy greens. Leafy greens like spinach, kale, Swiss chard, romaine lettuce, and arugula are nutrient-dense foods packed with vitamin K, folate, natural nitrates, potassium, and flavonoid antioxidants. These compounds play a central role in protecting blood vessels from atherosclerosis, improving endothelial function, and maintaining stable blood pressure. Vitamin K helps regulate blood clotting and lowers the risk of arterial thrombosis, which is especially important for people with a history of heart disease or those over the age of 50. Natural nitrates found in greens are converted in the body into nitric oxide, a compound that relaxes blood vessels and improves blood flow to the heart and brain, reducing the risk of heart attacks and ischemic strokes. Leafy greens are also high in fiber, which helps slow the absorption of sugar and cholesterol, supporting better control of blood glucose and blood lipids, two key factors in preventing heart disease and stroke. A meta-analysis of multiple international studies found that consuming leafy greens at least 5 times per week significantly reduced cardiovascular mortality in middle-aged and older adults. These vegetables can be eaten raw in salads, lightly steamed, sautéed with a small amount of plant-based oil, or added to soups and grain dishes. Darker green varieties should be prioritized, as they contain higher levels of micronutrients and offer stronger antioxidant protection. Incorporating leafy greens into your daily diet not only benefits heart and brain health, but also supports digestion, helps with weight control, and reduces chronic inflammation throughout the body as you age. 9. Berries. Berries, including strawberries, blueberries, raspberries, and blackberries, are rich in anthocyanins and polyphenols, plant compounds known for their powerful anti-inflammatory and antioxidant effects that help protect the inner lining of blood vessels. These nutrients guard against damage caused by free radicals, reduce chronic inflammation, and support arterial elasticity, helping slow the progression of atherosclerosis. Berries also promote better blood flow to the brain, lower blood pressure, and help regulate blood sugar, 3 key risk factors for heart attack and stroke in older adults. A long-term study by Harvard Medical School involving over 30,000 middle-aged women found that those who consumed berries at least 3 times per week had a 12% lower risk of stroke compared to those who ate them less frequently. Berries are also high in vitamin C and fiber, which support immune function and improve glucose metabolism, especially beneficial for individuals with high blood pressure, prediabetes, or metabolic syndrome. You can enjoy berries by adding them to oatmeal, using them as a healthy dessert, or blending them into smoothies without added sugar. Choose fresh or plain frozen berries and avoid canned versions with syrup or preservatives. For adults over 50, making berries a daily part of your diet not only protects the heart and brain, but also supports vision, memory, and slows cellular aging. Warning: foods that quietly damage your heart and blood vessels. While some foods can protect your heart and brain, others quietly increase your risk of heart attack and stroke, especially if you're over 50. Many people continue to eat these harmful foods daily without realizing they're damaging the endothelial lining of blood vessels, fueling chronic inflammation, and accelerating the growth of arterial plaque. First on the list are processed meats like sausages, bacon, deli meats, and canned meats. These products are loaded with sodium, nitrates, and saturated fats, all linked to high blood pressure, abnormal cholesterol levels, and injury to endothelial cells. Next are foods containing trans fats, often found in packaged pastries, deep-fried fast foods, and stick margarine. Trans fats significantly raise LDL cholesterol and lower HDL, creating ideal conditions for plaque buildup in arteries that supply the heart and brain. Excess consumption of refined sugar, commonly found in soft drinks, cookies, boxed cereals, and processed sauces, also contributes to systemic inflammation, raises triglyceride levels, increases insulin resistance, and damages the delicate inner lining of blood vessels, especially when blood sugar spikes repeatedly. A high sodium diet is another silent threat. It leads to chronic hypertension, damages small blood vessels in the brain, and raises the risk of silent strokes and long-term cognitive decline. What's most concerning is that these harmful foods don't always taste salty or greasy. Many are disguised with labels like low-fat or diet, yet they contain hidden sugars or excessive sodium. To truly protect your heart and brain, it's not enough to add healthy foods. You must also actively remove or limit the harmful ones, starting right in your own kitchen. Preventing heart attacks and strokes isn't just theory. It's entirely achievable through specific and simple changes in your daily meals. After age 50, every food decision you make has a direct impact on your vascular health and your risk of cardiovascular events. Instead of focusing on eliminating all harmful elements at once, a more practical and sustainable approach is to gradually replace them with healthier options. One of the most effective strategies is to build your daily menu around at least 4 to 5 items from the top 9 heart-protective foods we've discussed. For example, breakfast could include oatmeal cooked with unsweetened almond milk topped with fresh berries and a spoonful of crushed walnuts. Lunch might be a green leafy salad dressed with extra virgin olive oil, half an avocado, and a handful of boiled chickpeas. Dinner could feature steamed or lightly grilled salmon with ripe red tomatoes and a serving of lentils. As a snack, a small piece of dark chocolate with a handful of unsalted nuts can be both satisfying and beneficial. Beyond choosing the right foods, it's critical to learn how to read product labels carefully. Always check for sodium levels, added sugars, and hidden trans fats in packaged foods. Prioritize fresh, whole ingredients and minimize processed or frozen items with preservatives. Also, try to maintain regular meal times and avoid skipping meals, as fluctuations in glucose and insulin levels can strain your blood vessels and lead to poor blood pressure control. If you're currently on medication for blood pressure, cholesterol, or diabetes, talk to your doctor about how dietary changes can support your treatment and potentially reduce your reliance on medication over time. Cardiovascular health doesn't require drastic overhauls. It starts with small, informed choices repeated every day, guided by patience and the right knowledge. No heart attack or stroke happens entirely out of nowhere. These events are the result of months or even years of silent, cumulative damage inside the blood vessels, most of which stems from what we eat every day. If you're over 50, now is not the time to delay taking care of your heart and vascular system. You don't need to change everything overnight. Just start by adding a few heart and brain protective foods to your meals one day at a time. Fatty fish, dark chocolate, ripe red tomatoes, extra virgin olive oil, fresh avocados, whole legumes, unsalted nuts, dark leafy greens, and natural berries are 9 reliable choices that can form the foundation of a healthy vascular system. At the same time, begin to gradually remove foods that are silently damaging your arteries, such as processed meats, trans fats, refined sugar, and overly salty foods. Remember, you don't need to wait for severe chest pain or sudden dizziness to start paying attention to what's happening inside your body. The choices you make at the table today can determine whether you face chronic illness or live a long, healthy life. If you found this video helpful, don't forget to follow our channel and share this information with family and friends, especially those who are at greater risk due to age. By changing your eating habits, you're not just protecting yourself, you're also helping spread a healthier way of living throughout your community. If this video helped you better understand how to prevent heart attacks and strokes, hit the follow button now. Each week, we share simple but important guidance to help you care for your heart, reduce your dependence on medication, and stay healthy for the long term. Follow our channel so you won't miss the information that could make a real difference for you and for your loved ones who may also be at risk.